Well, good afternoon, everyone. I'm delighted this afternoon to have with me the Chief Constable of Isle of Man Constabulary, Gary Roberts, who will provide an overview on how the Isle of Man Constabulary is dealing with the additional demand on its resources and the unique challenges presented by the coronavirus COVID-19 pandemic. Our police officers are another example of the dedicated professionals who are working tirelessly to protect our community, to support our vulnerable citizens, and to ensure the Isle of Man remains a safe place to live. On behalf of the people of the Isle of Man, I wish to thank them for their service. Firstly, I'd like to give you the most recent testing figures. Since the last update at 10 o'clock this morning, there have been no further confirmed positive tests for COVID-19, so the overall total remains the same as 10 a.m. today at 158 cases. There are currently 7 confirmed cases in Nobles Hospital, with 22 patients awaiting results. So far, we have undertaken 1,824 tests in total, with 1,541 results back, leaving 283 results outstanding. The total presumed recovered now stands at 82, leaving us with 75 active cases. To everyone who is in Nobles Hospital or recovering at home, I wish you strength and fortitude. As you know, the Chief Minister is experiencing mild symptoms and is currently self-isolating at home as a precaution. I've spoken to him twice today and he is continuing to lead the Isle of Man Government's response to the pandemic, and this morning chaired a video meeting of the National Strategy Group. The Government's response includes taking delivery this week of 65,000 face masks with the support of Loganair and the Armed Forces. Those masks will be put to use immediately as part of the personal protective equipment worn by our colleagues working on the front line of the island's health and emergency services. Make no mistake, this deadly virus has nations around the world in its grip. It is among us here in the Isle of Man and will remain so for some time. Now is not the time to be complacent. We must redouble our efforts. We must ensure that Nobles Hospital is not overburdened. We must flatten the curve that I spoke about yesterday and ensure that our outstanding health workers can continue to help people most in need. I want to take this opportunity to thank everyone who is playing their part by staying at home. Those who are putting the common good ahead of personal interest. It is tough and people are understandably frightened. We are missing our loved ones, but social distancing remains the most effective way of breaking the chain. Self-discipline is key, particularly as we approach the holiday weekend. Easter is traditionally a time of hope, of renewal, of starting afresh. This year we must celebrate in a different way. The weather may be improving, but this devastating disease is still spreading. Do not be tempted to deviate from the guidance issued by our medical experts. Save lives, stay at home. If you do go out to exercise, remember to stay at least 2 meters away from other people at all times. Do not gather in groups. We must remain resolute and good-humoured in the face of this invisible enemy, and together, if we do that, we will turn the tide. I will now hand over to the Chief Constable for an update on how the police are serving the island during these difficult times. Chief Constable.
Thank you, Minister, and hello everyone. I'm grateful for the opportunity, and I'm pleased that the Minister recognised what my officers are doing, and I'm very proud of the efforts that they're putting in. I thought today I'd touch on 2 or 3 things. I'd talk about the approach the Constabulary are taking to this public health crisis. I'd talk about what's actually happening, and then I'd sort of cast my eyes to the future, and that resonates with what the Minister said about the weekend and Easter coming up. I'd start, though, I think, by just thanking everyone. I predicted with my colleagues at the start of this that most people, most of the time, would comply with what's required of them, and one of the things we found very clearly in the early stages, and as we get now into the 3rd week, that people are complying. The vast majority of people in the Isle of Man are doing the right things all of the time, which makes our job so much easier. And our job and our approach to this is very, very clear. Enforcement comes last. We will engage with people, we'll explain things to people, we'll encourage them to go home if they're in the wrong places, and ultimately we will enforce. Because this is a public health matter, and we haven't become a police state overnight, and it's important that the police can police the Isle of Man with the consent of the public. And when this is all over, I want us all to look back and say together we achieved what we needed to do to protect the health service. However, the tolerance levels that the constabulary has are not boundless. Yet early this morning we arrested somebody for being breaching the regulations. We've also reported another person today for a breach of the regulations, and people will go to court if they don't take our advice. And our advice is very clear. The law says you can only go out for specific purposes, and if you go out for other purposes and you congregate in groups, then if you don't take telling, you'll find yourself facing the courts. And one of my counterparts in England and Wales, the Chief Constable of Devon and Cornwall, Sean Sawyer, last week said, if a fixed penalty notice changes somebody's mind, yet the deaths of thousands of people don't, there's something fundamentally wrong with those people. And I echo those comments, and I fully support them. So if our approach is a tolerant one, people need to know that that tolerance won't last forever. So what's happening? Life goes on. We still police as we would normally do. We're going to domestic disputes. We're going to deal with minor offences. We're going to deal with people who are in distress because of mental health issues. So policing is largely the same as it was before, except I can give you some figures on this. Crime has halved in the period of the lockdown, but domestic disputes have gone up by about 71%. Now the numbers are only low, but that indicates to us that people are finding it difficult to be with each other. Road traffic collisions have reduced by 85%. Now that for me is pretty spectacular and gives me comfort that the public are driving within the 40-mile-an-hour speed limits. But every day we go to between 30 and 40 calls about breaches of the COVID regulations. So this lies in the hands of the public. Just simply don't breach the regulations if you can. And if you see people breaching, then ring up the COVID helpline. Now the COVID helpline has been set up by the government to take some of the pressure off the constabulary, and all the calls that go in there are handed on to the constabulary to deal with. So that demand we think will be pretty constant, but then looking ahead, fine weather, Easter weekend, I really would stress to people, just hold your nerve. We're in this together, and we're in it not forever, but we're in it for a fixed period of time, and that fixed period of time will retreat if you don't comply with the law. So the more people breach the law, the more difficult it will be for the government to relax the regulations. So just hold your nerve, and as Easter comes, please don't go and deliver Easter eggs to your grandchildren, because that's not an essential journey. And we've found ourselves on social media talking about what is an essential journey. Exercise is essential, but driving 15 miles to exercise probably isn't essential, and we'll stop you if we find you and say this isn't an essential journey. So just be careful, we're all in it together, and we need to hold our collective and individual nerve, because we will get there in the end. A couple of pleas. The local farming community is asking people, really, do you need to exercise on land alongside farmland? Do you need to let your dogs off when people have recently had new lambs and they've had calves? Please just think very carefully where you exercise and why you exercise. And then some people who work in the service industry and some people who work in the public sector who have dealings with the public, they think some members of the public are not following the distancing rules, and they are getting too close to them. So if you're in a shop, or you're dealing with somebody from the ambulance service or a police officer or somebody who is there to help, just give them their space as well, because they are just as anxious as all you are about getting the virus. So far, so good, but we just have to hold our nerve.
Thank you very much, Chief Constable. I'll now take questions from the press, and first up today we have Chris from Energy.
Minister, I'd like to address the Chief Constable, if I may.
Yeah, of course.
Hello, Chris.
Good afternoon. I hope you and all officers are keeping safe during this pandemic. First of all, how difficult have you found policing and adjusting to the new rules that government have put in place?
Officers have found it a bit of a challenge at times, because the regulations have changed a couple of times, and they are constantly evolving. I'm so encouraged by what officers are doing. So to explain that, at the very early stages of this, we created what we call 2 COVID teams. So these were teams of officers who had enhanced public protection equipment, and they respond to nearly all of the COVID complaints. They've picked their job up incredibly well, and they are now a tremendous asset to us. The rest of the force, however, has been really flexible. We got to a stage about a week ago where we were missing 30 odd people, and that put us under a bit of strain. So we, in our planning terms, lapsed from green into amber, which meant that we had to change our shift patterns, and we collapsed a number of shifts and changed teams. Officers just got on without any complaint. We're at the stage now where we're back in green, so we're all not quite fully staffed, but staffed to a great level, and officers are simply getting on with it, and they're dealing with it in such a patient, such a professional way, and I'm really pleased with what they're doing.
You're happy with the communication between the department, the government, and the constabulary?
I think when we look back on this in a year or two's time, we'll be able to say the way the public service has worked together on this has been phenomenal. I've been a public servant for nearly 40 years, and I've never seen a level of cooperation before that we're seeing now, where people are coming together and doing things that in the past would have been stopped because, well, the rules say you can't do that, or there's a barrier on a budget, or there's a barrier on whose responsibility it is. That's all gone. And the challenge for us as a public service is to make sure when this emergency is over, we don't lapse into those bad ways.
The Health Minister called it an invisible enemy in his statement just then. I'm sure you want to ensure the virus remains that enemy and you're not searching for reasons to make the general public a target. There have been reports on social media of police overstepping the mark on occasion when it comes to enforcing these new measures. Now, this is new territory for all of us, and I appreciate that false stories get circulated online as well, but how confident are you that all your officers out patrolling are aware of exactly what members of the public are and aren't entitled to do?
I'm 100% certain that they're aware, because they are briefed every single time they set foot out the door. So today, for example, the briefing has been tweaked ever so slightly, and it's been tweaked to take account of Easter weekend coming up, and it's been tweaked just to say that if anything, we've probably been too tolerant of one or two people, and those people have had their chance, and if they come out and do things they shouldn't do again, then we will enforce the law against them. So I'm convinced officers know what they have to do, and I used a phrase in my opening remarks about policing by consent. When this is over, we still will be policing the Isle of Man by consent. So if we take an approach that is draconian now, and we take an approach that absolutely damages people and the relationship the public have with the constabulary, then we would pay a price for that for a long time to come. So we will do what we have to do to deal with this public health emergency, and we'll do what we have to do to protect people in the health service, because that's what we're doing this for. But we'll do it in the way I've described, and I'm absolutely convinced that officers get that 100%.
Thank you very much.
Okay, next up it's you, Josh, from ITV.
Thank you, Minister. I've got two questions, one for you to begin with. I'm just looking for some clarity on the 21-day lockdown that is in place for the borders, and given we've heard very little since the lockdown was announced, should we expect the borders to remain closed after the 17th of April or to be reopened, and what factors are being looked at to decide whether to keep them closed or reopen them in some form, and is it linked to the reaching that peak number on the graph that we saw yesterday?
Right, so I touched on this very briefly at yesterday's press conference, just going into a bit more detail. There is a clinical assessment currently being undertaken as to where we are. We are still going to need about a week's worth of data to actually know that. People will have seen the graph that was put up on screen yesterday. The green line was the one that is now also on social media, but the green line is the one that's showing what our actual cases compared to the graph. It's still too early in that process, and we will be having to make decisions over the next week around where we're heading with the lockdown, and those decisions will be communicated to the general public at some point next week. But at this point, it's too early to make a clinical assessment on exactly where we are in that curve, and that is what is important that we need to base our decisions on.
And my second question to the Chief Constable, please. Chief Constable, thanks for coming in today. My question is, do you feel the current rules and restrictions around social distancing are tough enough, given we're still hearing of a lot of people out at social gatherings on beaches, amongst other reports, given it can only take a few people for this virus to spread widely, and you said about up to 40 calls a day you can be receiving, could the message be stronger, or could we see the deterrent become greater over a period of time?
I think it would be a failure if the law changed and became tighter. As I said in my opening remarks, nearly all of the people of the Isle of Man, nearly all of the time, are complying really well with this law. there are some people who will be tempted not to, and there are some people who are an antisocial nuisance in normal circumstances, and largely it's those people who are antisocial nuisances in these circumstances. So I would be worried if we had to tighten the law, because we are not in a police state, and we are all in this together. You know, my officers are no different than ordinary members of the public. They have their own fears about the virus. They have their fears about whether they'll infect their loved ones. And I think if the messaging is around that, and I talked before about what the Chief Constable of Devon and Cornwall had said, that message gets across to nearly everyone, and we are not afraid to enforce the existing laws against people who simply step out of line and won't take a telling.
Thank you.
Okay, next up we have Sam at Isle of Man Newspapers. Good afternoon, Sam.
Good afternoon. Sorry, just before I ask any questions, can I just ask, could you repeat the figures again at the start, please? We've had a bit of a problem with the stream there. So
yes, certainly, yeah. So if you bear with me 1 second, Sam. So since the last update, which was 10 o'clock this morning, there's been no further confirmed positive tests for coronavirus. So the overall total number of cases remains exactly the same as it was at 10 a.m, which is 158 cases. There's currently 7 confirmed cases in Nobles Hospital, and we also have 22 other patients that are awaiting results. So far, we've undertaken 1,824 tests. We've got 1,541 of those tests back, and that leaves 283 tests outstanding return. And the total presumed recovered now stands at 82, which means that we have 75 active cases on Ireland.
great, thank you. And the first question is for you about the testing capabilities that we're going to have at Nobles. In terms of the long-term future of that testing, what capability is that going to have after this pandemic has passed?
Well, there are going to be certain things from our health service point of view that will be good that come out of the virus as well. I've touched on this before. We would be looking to see if we can keep the testing facility in place. If we can, then things such as winter seasonal flu testing and other disease testing may be able to be done. It's not what we are building, I need to be absolutely clear though, is not some huge microbiological lab like they have in the UK. So it's not one of these multi-million pound facilities you would see in Manchester or other parts of the country down in London. It is very much a limited testing facility, but we will be looking to see what we can do to retain that after this. And what we can use it for, just as the building we're doing up at Brown Newlands at the moment to expand the bed capacity and provide an extra 50 beds. We will be looking to see what we will be doing about retention of that afterwards as well. So there is certain things that are going on within our health service that we will be looking to retain afterwards. So as dreadful as this pandemic is, there is certain things that our health service will have benefited from and be able to maintain afterwards.
Thank you. Then can I just go to the Chief Constable?
Yeah, of course.
Good afternoon, Chief Constable.
Hello.
So, in terms of, you said domestic cases were up 71%, was that correct?
Yes, 71.
And just in terms of that, what sort of, obviously it is almost a serious issue, it's domestic in any sense, but what seriousness are we seeing these rows that have overspilled and that's becoming more serious issues?
It's too early to read much into the figures. So although 70% increase is big in any terms, it's too early. But people are getting on top of each other. So they range from people who are just fed up and they're having arguments, and people naturally will be worried about health. They'll be worried about their finances. And there's no escape route or escape valve for people. So they're at a low level sometimes. But we did deal with a wounding yesterday where somebody wounded a partner. And my fear, and it's a fear I think borne out by people in my position all across Europe, I guess, is that the longer this goes on, there'll be a greater risk of more domestic incidents. And we have to be very careful that we put in place all the support mechanisms that are needed for people who find themselves in difficulties. And I'm pretty happy with the work that's been done in the Isle of Man. But if those figures remain the same in 3 weeks or 4 weeks or 5 weeks' time, then we might well be looking at a bit of a problem. But hopefully with the things that we're doing, that won't be the case.
Thank you.
And next up I have Tim from Manx Radio. Good afternoon, Tim.
Minister and Chief Constable. I'm going to give you a rest if that's all right, Health Minister, and fire questions.
I'm not going to complain, Tim, I promise you. I'll invite the Chief Constable to come back.
You have to make the most of this, Tim. I'm not coming back again.
Exactly, sir. So we'll get the double penny's worth then. We've had reports of some pubs having private lock-ins, and in some cases repeatedly doing this. Also, rumours and reports of parties at houses being planned over Easter. Are you aware of these, and what powers do you have?
We have ample powers, so we can enter premises if we need to, and the emergency laws give us the power of entry and power of arrest. We've been to 2 licensed premises where there have been reports of lock-ins. Certainly in one case there was no truth at all in it. The second one is ongoing as I speak. Make it very clear, if any licensee, any designated official breaches the law in this way, we will take them to the licensing court and have the licence cancelled. And that's not an idle threat, that's what will happen. So if there are licensees out there who are tempted to do this, and I'm a great friend of the licensing trade, I've been a great supporter of the licensing trade all my time in senior positions, I will have no compunction at all about having their licence cancelled. That's how serious this is. And then if people decide foolishly to have house parties and we find out about them, then they will feel the full force of the law, that they're the sorts of people we're likely to prosecute.
And the second question I was going to ask around domestic abuse, but I think we've covered that quite adequately. But I have read your annual reports over a number of years, and increasingly the biggest amount of police time is taken up with mental health issues. So just broadening the topic out. So is that still the case, that you're finding that at the moment during this lockdown? And is it an issue that's likely to increase as people get frustrated?
Yeah, the figures that we've got show that the number of mental health cases is roughly on a par for where it should be, so it's not increased. My fear would be the longer the lockdown goes on, the more it's likely to increase, and understandably people are anxious and people are afraid, and people who have poor mental health will be even more anxious and even more afraid. There's a lot of work going on behind the scenes with between the police and the mental health service and a number of other parts of the public service to put in place support, and I'm convinced that if people need the support is there, but this will have a toll on people's mental health in the long term, and that's something that sadly is a price that we have to pay.
Thank you.
Just before we move on, I've been told apparently we've got some issues with the live streaming today. But people, please don't worry, because it is all being recorded and it will go up online, so people will be able to watch this back. But the technical gremlins are with us this afternoon, I believe. And at that point, it moves me nicely onto you, Paul, from MTTV.
It's because, David, you're a ratings winner that people will be watching you back.
There may be many reasons, but I don't think that's one of them, Paul.
Okay, can I speak to the Chief Constable, please?
Of course.
And James Light is here, because we've been asking you for a little bit. I'm sure you're aware that we keep asking.
Yeah.
Chief, you put this tweet up, which was quite interesting, about the 40-mile-an-hour limit thing, saying there's been less crashes and that sort of thing. But surely, I think everyone has said the same thing to me. What's the fact is that there's less cars on the roads, aren't there? So it's not really necessarily because of the 40-mile-an-hour limit, is it? Or do you believe it is?
Well, I think within an hour or so of the 40-mile-an-hour limit becoming effective, somebody rolled their car off the mountain when they were drunk. So that had nothing to do with less traffic on the road. That was to do with the way somebody was driving. And less traffic on the roads sometimes gives some people the chance to go faster. And so what we find, for example, in TT is if there's lots and lots of traffic on the road, there are fewer collisions. If there are gaps in the traffic, people go fast and crash. So the 40-mile-an-hour limit is a public safety thing, and it's there to take the pressure off the emergency department and the ITU. It's as simple as that. There's no hidden ulterior motive here to create a 40-mile-an-hour limit across the island after this emergency is over, because limits are no use unless you can enforce them in the long term. But for now, it's absolutely the right thing to do, irrespective of what the volume of traffic is on the road.
Okay, and picking up on being a policing by consensus, the Chief, from the very word go, the Chief Minister was saying that if this social isolating didn't work, he wouldn't hold back from increasing powers, whatever that exactly means. Are you in favour of that? Is it even possible to lock the population down if that was the next step?
The matter of powers is a matter for politicians. Politicians decide what powers the police have, and the police, whether we like it or not, will enforce those powers. So if the politicians said it's illegal to wear brown shoes, then I might shrug my shoulders and we'd get on and enforce the law and stop people wearing brown shoes. But in this health emergency that we're in now, enforcement can only take you so far. People have to realise that this is a health thing that can affect them and their loved ones. So if they gather in groups and one of them's infected, they might take that home and kill their grandmother. That's the top and bottom of this. So as big as the Isle of Man is in comparative size and the few number of officers I've got, we can't be everywhere all the time. So we rely on the public to do their best. And my guess is that 90-odd% of people do the right things all the time. If anybody chooses not to, then they run the risk of finding themselves in prison. And if that's what they want to do, fine. But the greater risk is they'll infect their family and harm them. So, you know, if people want to take that risk, it doesn't matter what the laws. You could have the most draconian laws in the world, but people like that wouldn't obey them anyway.
Okay, before you speak, can I just ask, how many people have you fined or given instant fines to yet? Any or?
Well, we haven't quite got the powers yet. The powers are rumbling their way through. Royal assent was needed for some part of the primary legislation, and that hasn't yet been there. The regime to issue fixed penalty notices has been created in record time. When we did enforceable fixed penalty notices for road traffic matters, it took us about 2 years to get the regime up and running. We've done this regime in a couple of weeks, but we just need the final bit of the law to be in place. So I think next week we'll be able to do that. I hope that won't come to that, but if it does, we won't be afraid to use them.
Thank you.
Just to expand on that, people will probably be aware that the bill went through the branches last week in record time, actually, for a bill. We did it in a single sitting, both in House of Keys and in Legislative Council. So it has now gone off for royal assent, and we're just waiting for the Privy Council to confirm that the Governor can put royal assent to the bill. At that point, then the powers will come in. So next up I have the BBC and Alex.
Hello, Minister.
Hi, Alex.
Can we just get some clarity over it? We had a press release, as I'm sure everybody else did this afternoon, that Villa Gaiety would be closed until the end of September. Is this indicative of a time when things are going to start getting back to normal at all? What was behind that decision to actually suspend all services there until that date?
Right, well, I know it's always tempting as announcements are made now to read a lot into them, to think, oh, well, that's the date they're thinking of everything being back at normal. It's not. It is literally the Villa and Gaiety planning ahead. We are likely to have cases in the community, even if there are low-level cases, for a substantial period of time. It's not because there's been any great medical decision as to when we're going to be locked down till, or when we're going to bring services back online. That has purely been taken by the Villa and Gaiety complex, who decide that realistically, in terms of shows and the stuff that they've got booked ahead, they're not going to be able to be back up and running until that time at the earliest. So it's been a commercial decision on part of them. What we've got to remember as well is a lot of what goes on in the Villa and Gaiety is actually from bringing people into the island. So there's a lot of people who come from the UK to run the shows, etc. So they've got to look at what's going on in other areas and other jurisdictions as well. And I think the decision's been made that a lot of the shows that hadn't already cancelled up to that period, they wouldn't be able to go ahead because they wouldn't be able to get the performers in place because of what's happening in other jurisdictions. So no, people shouldn't read anything directly into that announcement today. That doesn't mean we're going to stay in lockdown until September, October, but equally it doesn't mean that there's some secret plan for rephrasing things and opening them. That will all be done on clinical advice.
Thank you. Can we speak to the Chief Constable, please?
Of course.
Thank you.
Hi, Alex.
Could we just expand a little more on that figure about the domestic abuse incidents, please? Because that's a real increase, 71%, I believe you said. There are going to be people who are in difficult family situations, shall we say, perhaps partners, children, members of the family unit who are facing abuse, who outside of this might have had an avenue at least to escape from. Now they're stuck inside with these people. These are real situations. What advice are you giving to those today?
It's a very difficult situation, and I recognise very well how you describe that. I sit on the safeguarding board as well, and from a safeguarding perspective, this health emergency presents all sorts of problems, because you're right, people do not necessarily have the escape routes that they would normally have. They do not have the ways of getting out and away from abusive partners, and there has to be a means for them to share what they're going through. And we would encourage anyone, if they have the opportunity and they are in those situations, to contact us or contact any other support services like Victim Support or the Women's Refuge, because it will be a very trying time, this, and we're in this for a while yet, I think, and we have to make sure that people know that the help is there for them if the opportunity arises. So it's difficult, and I'm not offering a very easy way out for people in this, but they need to know that if they can, we will come and respond and do everything we can to safeguard them and protect them.
Thank you.
And she's waited very patiently till the end, but last but not least, we have Leanne from 3FM.
Thank you. Hi, Minister. Hope you're well.
Hello, Leanne. I'm absolutely fine.
Good. My first question is to yourself. What checks are being done with those who are presumed recovered? Because obviously we're seeing those figures now.
So there's no checks done. We work off the same basis as the World Health Organization definition for recovered, which is someone who's gone through 14 days. So they've gone through their 14-day period, they've not been back in touch to say they've deteriorated, and therefore they're presumed recovered. Where I think there's been some confusion online is people are saying, well, is that different to the way other jurisdictions are doing it? While there are some jurisdictions that do sample testing and so on, there is no jurisdiction around the world I can find that retests everyone to see whether they're cured or not. In fact, I'm not even aware of a test that would be able to do that. The difference is we are using the precise medical term, which is presumed recovered, whereas a lot of countries just report it as recovered. So if people go online and look at the World Health Organization's figures, they'll see columns for recovered for various countries. In most of those countries are calculating it in exactly the same way we are.
Okay, and my second question for the Chief Constable, please.
Hello.
Hi, Chief Constable. I just wondered if you could provide me with some clarity. We've got quite a lot of queries on what forms of ID key workers need to have on them if they're stopped and asked why they're travelling.
So some key workers have got identification. So if you work at the hospital, you'll have identification. Some charities have been in discussion with us, and they're having letters that they're going to display in their vehicles. We will take a flexible approach, so whatever people provide us, we'll take. Just as by way of illustration, last weekend one of my officers spent time in Crosby and stopped a lot of traffic over a period of about an hour or so, and he found that something like 95% of people were out for the right reasons. And so people who are not out for the right reasons, we'll deal with. People need to be as pragmatic as we are. So if you work at the hospital, you've got ID. If you work in Tesco, you'll have a Tesco badge of some description. That for us will be enough.
Okay, thank you.
Well, can I take the opportunity to thank the Chief Constable for coming along? Oh, sorry, there's an extra question from you, Chris.
Yeah, just one more for the Chief Constable before he leaves, if I may.
Yeah, of course.
You're in demand this afternoon.
And I'm getting my 10,000 steps in just walking backwards and forwards here. Right?
I just wanted to know if there is a particular demographic which appears to be flouting the social distancing rules that you've noticed so far.
We put a social media post out last week where we talked about young people, and I think the biggest issue we've got is with teenagers and people around the late teens, early 20s who seem to think that the rules don't apply to them. When I was driving down to Government Office here before from my office, I spoke to a group of 4 who were at the end of Tynwald Street. So I think it is that demographic, it is that set of younger people who probably feel immune to this. They probably feel that they're not vulnerable because they're fit and well, and they've read things that say that this only applies to elderly people. Well, it doesn't, and even if it did, as I said earlier, they'll be taking the virus back to their grandparents and killing them if it works out badly. So that's the group we have to get the message across to, I think.
And in that case, if you stop them, do you take them back to their respective houses? Do you tell their parents to monitor them more closely, or what can you actually do?
Well, if they're older teenagers, we can't. The parents have got nothing to do with it. But we've had dialogue within my team about our approach to parents, and I think we'll reach the stage, if that demographic, if that group of young people doesn't change its approach, where we will start holding the parents to account. Because as hard as it is with teenagers, you do have to know where they are. And recently Castletown Town Commissioners closed Poulson Park, I think, because they were concerned about young people gathering in the park at night. Well, their parents need to know where they are, because they can't be out because they're breaking the law. It's as simple as that.
Thank you for your time this afternoon.
Okay, thank you.
Just before I take the additional question from Paul, just to add to that, young people most certainly aren't immune, and it's important that we get the message across that they aren't. In the UK, of course, they have tragically seen the death of a 15-year-old, which is their youngest victim. So it is important to re-emphasise that message again, that young people are not immune from this virus. It's a horrendous disease, and it affects all of us throughout our community. So Paul for another question next, then Sam, and then Tim.
Thank you, David. It's for you, actually. David,
So it's for me. Oh, it's for me. I'm popular again.
Well, I have to ask you a question. How is the Chief Constable? Have you spoken to him today? And when is he likely to get that text message to say he has or hasn't got it? Because obviously the top reporting times changed.
Well, I'm hoping you meant Chief Minister, not Chief Constable, first of all, Paul, since the Chief Constable is here with me, and you're telling him something he doesn't know. In relation to the Chief Minister had his tests done in the same way that everyone else does. It has gone off for processing, and it will come back in due course. We touched on this yesterday. There's been no special treatment for the Chief Minister. He will be in the processing queue along with everyone else awaiting it back. But the important thing to emphasise is, regardless of whether the test result comes back as positive or negative, the Chief Minister will still be required to self-isolate just like everyone else for the 14-day period. He is absolutely fine. I spoke to him this morning, and also I've been in contact with him throughout the day. He chaired the National Strategy Group remotely this morning via video link, just as we're chatting now, and he's showing the signs of the cough and the fever, but he is running the Isle of Man government as normal. Okay, Sam next, and then Tim.
Paul actually stole my thunder a little bit. Actually, can I go to the Chief Constable again?
Of course.
I just wonder if you could just perhaps give a bit of an idea in terms of you said about the figure of officers who are off. In terms of percentage, is that frontline officers or is that more office staff? And just to give an idea of what percentage you've had to adapt to.
We've actually got a higher percentage of our support staff off than we have the police officers. I think the last figures I saw said we're about 14% absent, which is okay. So we've used a planning model that was set out a couple of months ago by the National Police Chiefs Council in England, which gave us a red, green, amber, red, black set of circumstances. We lapsed briefly into amber because we had 30 odd people off. We're now where we ought to be. We've still got about 4 special constables who are working with us on a daily basis just to make sure the numbers are right. But our projections show that as we get into next week, we'll be absolutely fully staffed, I think.
And then last question of the day goes to Tim.
And it is to your good self. Since this morning's update and this afternoon's, it's great, no more confirmed cases, but I work it out that we've only had 2 more tests back since this morning. Is there a pattern of when we get the tests back to the island, or is it just very random?
It literally depends upon the labs. Obviously, it will be a lot more of a pattern when we've got the testing facility here on Ireland. But as you would expect, and you've got to appreciate, in the UK, the labs are under pressure. They're dealing with 16,000 plus tests a day. They're not just processing our tests, they're processing tests in the Channel Islands, the high volume of testing in the UK that's increasing now. They've gone back to community testing, which we never gave up. So it can vary. And I wouldn't read too much into the individual numbers on a daily basis. I think what's important is we look over a period of time, and that's what I keep emphasising because I do get people who get in touch with me and say, oh, that's excellent, there's only 2 more confirmed cases today, it's going away. And I always stress to people we need to take a long-term picture at this. We can't just look at it with individual days at a time. We need to be taking a look at weeks at a time to see any trend data. So can I thank the Chief Constable for coming along today? I'm sure it's been very informative for people. So thank you very much, Chief Constable. I would also like to add my thanks for all that the emergency services are doing at this time. As Minister for Health and Social Care, I normally thank the ambulance service for all they are doing, but of course our emergency services are much wider than that. They really are our frontline community defence against this virus. So one of the things I would stress is please treat them with dignity and respect. If you see police officers out and about, if they stop you to speak to you, please at all times treat them with dignity and respect. They have a job to do and they are there for our protection and our safety. I would like to end with a round off of some shout outs. So the first one today goes to the People of Peel Support Group. This valued community organisation has been in existence since 2011 and has almost 2,000 members. It offers a wide range of help and information for our friends in the west of the island. The group is currently providing online pilot classes, some uplifting photographs, the new opening times for the post office and details of delivery services offered by local restaurants. One particularly eye-catching image is a picture taken at Peel Promenade yesterday afternoon that caught my eye at 3 p.m. On a lovely sunny day, Peel Promenade was deserted. Nobody was out. Everyone was staying at home and saving lives. So well done to the people of Peel. Our second shout out goes to Corinthians Football Club, which has donated the magnificent sum of £1,000 to Isle of Man Food Bank. The club made the donation to support those in need and to raise awareness of those requiring help during these difficult times using the hashtag #BeKind. The food bank is grateful for the club's support and is hoping that we can all show COVID-19 the red card very soon. Another nomination for a shout out has come from a pregnant woman whose husband is employed at the power station. He is working long shifts while continuing to support his wife and their disabled son. He is her hero, along with the team at Manx Utilities at the power station who are helping to keep the island running. I would also like to give a shout out to all those with the youth service who have been helping deliver the courier across the island. Many in our community don't have or can't use the internet access and so still rely on our print media. So thank you to all those helping to keep those residents informed. Also, as Minister for Health and Social Care, I'd like to personally thank the housekeeping service across all of the department's estates for all they're doing in continuing to work as diligently as ever during this difficult time. The work they are all undertaking is appreciated, and I want to say thank you to them again for today for that. So thank you to all these people, to everyone else who is rising to the challenge on behalf of our nation. In finishing, we have a short video clip for you. I know that many viewers have found the videos featuring our health and social care colleagues and the people in the community who are keeping the island moving to be powerful and inspiring. The following clip highlights the vital contribution made by our emergency workers. Please take a moment to watch the video and reflect on the important messages. I will be back tomorrow and I will be joined by the mental health services, which will be the focus of that briefing. And I leave you now with the video clip. Thank you.
Coronavirus has impacted the way that we live and interact as a community.
And it means we're asking you to help us.
To help our community.
From emergency services to manning call centres.
From community testing
to being there for you when you need us.
We are working hard to keep our island safe at this challenging time.
We're all in this together.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island,
For your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.